All right. Now we'll go to Ms. Nadler-Olnick. Ray, you'll have 3 minutes.
Good afternoon, committee. Last month, an independent news poll revealed that a very substantial number of Austin citizens, approaching half at least, consider fluoridating our water a waste of money. This news should put to rest the notion that only a small fringe group objects to the practice. Now, if I were on a health committee, news like that would make me take a second look. If I had so misjudged the citizenry's level of awareness and concern, might I also have missed something else? In particular, I'd want to know, why do they consider it a waste? Is it because it's so clearly ineffective at preventing dental problems among the economically disadvantaged? That's its ostensible purpose, or anyone else for that matter. When I asked the full council at last week's meeting whether the revelation that nearly half of Austinites oppose fluoridation had caused anyone to change their position, nobody uttered a peep. Of course, Mayor Leffingwell didn't give you a chance anyway. Yet 2 months earlier, on March 22nd, the mayor was remarkably forthright in responding to my inquiry, quote, "How much does the city spend on direct dental care for low-income children?" And nobody here can answer that question, he announced. I found his statement extraordinary. How could he be so sure? But if true, the collective lack of curiosity is stunning. Direct dental care would include such things as vouchers for toothpaste and toothbrushes, education and basic dental hygiene, actual dental services for school children, such as the St. David Foundation provides through its mobile dental clinics program. If the mayor and council are that uninformed about what, if anything, the city provides in the way of authentic dental services, you're probably equally so about the actual dental condition of Austin's underserved children. And that's hard to find out. What we do know, though, is that since year 2000, every major federal and state report, like this one from the Texas Dental Association, that addresses oral health has reported a so-called epidemic of oral disease among low-income children. The reason is simple. Most dentists don't accept Medicaid, and poverty is increasing, or has increased. According to the U.S. Census Bureau, as of 2010, over 18.4% of Austin's population lives below the poverty line. That kind of shocked me. That's a lot of kids. So let's provide them with some genuine dental resources. It will cost more, but on the other hand, we'll be getting something for our money. Thank you.
Next speaker is Linda Green. Welcome, Ms. Green. You'll have 3 minutes. Councilman O'Reilly.
Thank you, Health and Human Services. As you know, we've been coming to you for over 3 years, going on 4 years. We at Fluoride Free Austin, presenting you with a number of facts about the fluorosilicic acid waste which you add to our water. And I'm very distressed and concerned that many of your websites, the Health and Human Services, the City Water, Water Board, District 17, starts out with some fluoride information saying that fluoride is added to your water. It's a naturally occurring mineral or element found in your groundwater or your rivers. And I would like you to change that information, because what you add to our water at the cost of about $500,000 a year for the product alone is hexafluorosilicic acid waste from the phosphate fertilizer industry. And if there's anybody in this room that would like to see the receipts for fluorosilicic acid added to our water, I'm sure you can find that with the Water Utility Board. Some of the other information I'm disturbed about is a warning with the WIC offices about fluoridation, and they call it a note on water fluoridation. It says, if you're concerned about fluorosis, You can minimize babies' exposure to fluoride in several ways. Breastfeeding, and then you can use alternate tap water, which is fluoridated, with non-fluoridated water for formula preparation. And then your doctor may recommend fluoride supplements beginning age 6 months. That I'd like you to strike that statement out of the note on water fluoridation, because no babies need fluoride waste at age 6 months. You're medicating us without our consent at one size dose fits all when you add it to our water supply. So here are some more facts. Current evidence, not science that's been withdrawn 20 years ago, as Dr. Wong sometimes presents at our debates, but the most current evidence, which also causes Europe, 95% of Europe, to stop adding fluoride to their water. So I'm asking you to please look at these folders and take a look. There's no particular order, but it's evidence that's been gathered from a number of different sources, including Dr. Paul Connett's website. You all know Dr. Paul Connett. He's been here several times, the author of The Case Against Fluoride, How Hazardous Waste Ended Up in Our Drinking Water, and the Bad Science and Powerful Politics That Keeps It There. So we want you to take a serious look at this. It's $500,000 a year, give or take, and that's just for the product. What about the insurance and management of a...
Thank you, Ms. Green.